Mongbwalu Hospital near the DRC's eastern border with Uganda is at the centre of the Ebola outbreak. The facility was attacked by young men demanding that the bodies of relatives who died be handed over to them. Medical staff were forced to evacuate the site, and tents put up by the aid agency Doctors Without Borders were burnt to the ground. The hospital's director says the violence has made an already desperate situation even more difficult.
There has never been an epidemic of this magnitude in the region. There have been rumours, people are saying the disease came from this or that person. And now they have turned words into actions. By burning down the facilities, they're slowing down our response to the contamination and our efforts to break the chain of transmission.
The bodies of those who have died from Ebola are highly infectious. With no vaccine or treatment for the latest strain of the disease yet available, doctors and nurses treating cases are themselves in danger of becoming infected.
The medical staff here are not trained to care for Ebola patients. That's why they're at risk of contracting the disease, since they don't know how to protect themselves.
Several patients absconded during the fire, vanishing back into the local community, and that has deepened the climate of fear. Health workers are running information campaigns in the hope of gaining people's trust. And in the city of Bukavu, there's been a surge in demand for hand-washing stations and other hygiene installations. Nonetheless, the World Health Organization is warning that the Ebola epidemic is outpacing efforts to contain it, and the situation will get worse before it gets better.
More on this, we're joined now by Katzer. He's the director of Doctors Without Borders Germany. Thanks for being with us. Christian, the head of the World Health Organization says at the moment the epidemic is outpacing us. Have authorities underestimated the danger of this Ebola outbreak?
I don't think they have underestimated it, but it's because of the nature of the extent and the circumstances of the outbreak which makes it going out of control currently. Authorities have tested for Ebola virus, but they haven't tested for the current virus, and therefore the outbreak went undetected and made it very difficult to intervene initially. Now we know which virus we are dealing with, and therefore we hope that there is still chance to bring that outbreak under control, even though we assume that the outbreak has spread, and we are talking of probably more than 1,000 infected people right now.
We keep seeing those numbers of infections and the deaths rising. What do medical teams on the ground need right now to get this epidemic under control?
So what we need is actually supplies for protective material. We need tents and other construction material to be able to isolate patients. And we need a lot of staff to actually bring in community acceptance and infection control in communities where safe burials, the follow-up of contacts, etc., is essential to curb the outbreak. And what we also need is much more diagnostic capacity, especially in some areas of the Democratic Republic of Congo, where the central lab in Kinshasa is still to confirm samples taken, and that travel time and gives huge delays, as we have other diseases in the area which also bring fever and symptoms similar to the one of the virus, of the Ebola virus, and therefore a quick detection of those cases who are actually confirmed positive of Ebola virus would be very important.
Now, there have been several attacks reported on healthcare facilities in the affected area. Why are some people there angry at the very people who are trying to help?
There's a number of reasons, including the whole area we are talking about is actually prone by conflict and displacement. So people are by nature very careful to trust authorities. The second one is that actually healthcare facilities in the area are not very well functioning. If people seek healthcare there, they often have to pay, and the care they get is not often good. So there's some people try not to go into health facilities. And the other one is actually that, and we have seen it also in the pandemic in many other places, that people don't trust necessarily what comes from central government or authorities in terms of information. They don't believe that the disease is really there, and they prefer to continue with their life and do not see that major outbreak impacting their own lives. So these three factors, I think, play a key role in the beliefs of people. And that's what I meant with community engagement. We really have to see that we get the message across that this disease is fatal and can impact everybody. But there's ways to prevent spreading, which includes just avoiding body contact. So it's a bit easier to prevent transmission than in, for instance, SARS-CoV, what we have seen around the globe a few years back.
Well, the virus does indeed seem to be spreading. How high is the risk of the outbreak spreading to other countries? There are already cases reported in Uganda.
Yeah, so overall, as I said, the transmission is not that easy, so that will make it almost impossible for it to become pandemic. But we will see numbers going up, definitely. We will definitely see other parts of the Democratic Republic of Congo seeing cases, because people are very mobile. It's a mining area where the major part of the outbreak is right now. So people are mobile. They have gone there to work. They will go back to the places they came from. And I would also suspect that we unfortunately will see some cross-border cases, so going into other countries, because as I said, healthcare is not very good in that area, and people who can afford it would probably try to seek better healthcare outside the region where they are now in.
Congo has experienced, the Democratic Republic of Congo has experienced many Ebola outbreaks in the past. Shouldn't it be better equipped to respond to these crises we're seeing today?
So overall, what we see on the ground is that the health authorities are equipped. So there's been quite a massive response from the Ministry of Health overall. People haven't expected that type of the Ebola group virus to come through. So the initial cases, my understanding is they have been tested for other Ebola viruses and has tested negative. What we see actually is that also there's a responsibility of other governments and the WHO, the World Health Organization, to actually invest also in research towards more neglected viruses, such as the strain which is currently causing the outbreak, to be able to respond faster and to have better surveillance in place and a better case detection rate, which would have prevented the outbreak of going so big as it is now.
Christian, thank you very much for talking with us today. That was Christian Katzer, Director of Doctors Without Borders, Germany.
Thank you very much.
Our coverage continues now with Caitlin Brady. She is the Danish Refugee Council's director in Democratic Republic Congo, based in Goma. She joins us now because this is not only a medical emergency, it is also a humanitarian emergency. Caitlin, it's good to have you with us. Let me just ask you, do you think that the world is reacting quickly enough to prevent this outbreak, this local outbreak, from becoming a regional disaster?
I couldn't speak to whether or not it will become a regional disaster, but definitely it is becoming a very large humanitarian emergency for Eastern DRC. The primary area affected is one that hosts hundreds of thousands of IDPs, and these are some of the most vulnerable people in the world. They have been displaced by conflict, by violence. They are scared, and they have very little in terms of material goods, very little to fall back on. They may or may not have access to water. They may or may not even have a latrine to use. In that context, it's extremely difficult for them to take all the measures necessary to protect themselves. In terms of the response, it absolutely is not keeping pace with the emergency. The containment has just not happened yet, and we're not keeping pace with the spread of the epidemic.
The situation you're describing is one in which we're seeing people, families that have been displaced. As you said, some people don't even have access to clean running water. I mean, this sounds like the perfect storm then for a virus to take hold and spread.
Exactly. In addition, this is a community that hasn't experienced Ebola before. The other Ebola epidemics that we've had in the DRC, and this is the 17th, have been in other provinces. Ituri has not been affected by and large by previous epidemics. This is a problem because the community does not necessarily trust healthcare workers or the government or people like us when we tell them, this is Ebola and you need to protect yourself and this is how you have to do that. You have to present yourself to the health authorities and go into isolation. People are afraid, and when they're afraid, they do lots of things that are irrational. So there's a lot of denial that this is real. And if people are sick, they may deny that they're sick. There will be families who will keep people who are sick in the house rather than bring them to the hospital for treatment. And that's a surefire mechanism for them to then contract Ebola and for the whole family to fall ill.
We know that there have been reports some medical professionals in the DRC have already died from Ebola. And I know that you and the people that you work with are taking all the possible precautions. But I mean, as someone who is there on the ground, tell us what goes through your mind now when you're dealing with providing medical care for others, and that medical care is right now seems to be paramount to everything else.
Absolutely, the medical care is the front line. Danish Refugee Council has a protection mandate, and we help and assist and protect displaced people. We do not work directly on health. We do work in water, sanitation, and hygiene. We do work on messaging for these communities. We do work on other forms of assistance. So, for example, we're working with some health agencies who can refer us indigent families who are affected by Ebola, and we can provide them with 3 months of cash assistance. We are also looking at protection, so making sure that services around sexual violence continue, that services for children, including potentially children who are orphaned by Ebola, continue, that education services continue. In terms of our first priority, it is, of course, to protect our staff so that they can continue to work and to develop those tools to make sure that we're protecting the beneficiaries as well while we work. But the second line of defense in any Ebola response is infection prevention and control. And that happens through hygiene, through surveillance, through isolation of people who are suspected. And so we all need to contribute to that second line. Once somebody has Ebola, they have to go into a treatment center. But the key to containing the Ebola epidemic as a whole is preventing the transmission. And that happens through other mechanisms.
Unfortunately, Caitlin, we're out of time, but we appreciate you taking the time. I know your time is very valuable right now to share your insights. We appreciate your time, and we certainly wish you and everyone working with you all the best. Thank you.
Thank you.